Hello, fellow dentists. Welcome to Saliva Cast. I am your host, Dr. Deborah Heller, a dentist, a scientist, PhD in neurobiology, professor in Brazil and the United States, and the current president of the Salivary Research Group of the IADR, which is the largest global association of dental research. I am also the founder of Saliva Pro, which is my mission, my goal. It is an initiative dedicating to teaching salivary diagnostics for more precise, preventive, and personalized dentistry, personalized care. And today's topic of Saliva Cast is intermittent fasting. This practice is becoming increasingly popular, but have you ever stopped to consider how it affects saliva and oral health? Let's talk science as always. Let's talk clinical guidance as always. And let's talk about prevention. And at the end of the Saliva Cast, I will share with you a complete guide to help you counsel patients who practice fasting. The reality is that many of our patients are doing intermittent fasting, and we need to know how to keep them healthy while they are doing this. So, fasting and saliva. What science already tells us, and this is fascinating. Intermittent fasting has become common among individuals aiming to lose weight or improve health. I practice it myself. But does going hours without food harm or benefit the mouth? It all begins with saliva, which is essential to neutralize oral pH, protect teeth, prevent caries, and control dental biofilm. During fasting, saliva production may decrease, which directly impacts the mouth's natural protection. With less saliva, the mouth gets drier, the risk of bad breath, halitosis, increases, and the pH may become more acidic, promoting caries and sensitivity. So let's look now at the connection of fasting, systemic, and oral health. Intermittent fasting and calories restriction diets have been studied as these non-pharmacological strategies for longevity and control of chronic inflammatory diseases. In various animal models, from mice to primates, these strategies have shown in several studies to reduce inflammation, better glycemic control, lower oxidative stress, and improve even cardiovascular and brain function. In terms of oral health, which is what I want to bring to you today at Saliva Cast, we still know little, but some studies do suggest that calories restriction diet may reduce gingival inflammation and even prevent periodontal bone loss. Although the evidence, I must tell you, is largely preclinical, so mostly animal studies. For instance, a classic study by Branch Mays published in 2008 used rhesus monkeys with ligature-induced periodontitis, and a portion of the animals received a diet with 30% fewer calories without malnutrition. And the result, the calorie restricted group had significantly less gingival inflammation and reduced bone loss. Another study by Reynolds in 2009 showed that this calorie restriction diet decreased inflammatory marker expression and in periodontal tissues. And finally, a study by Ebersol. Jeff made this very interesting study in 2008. He noted gender differences that females showed even lower inflammatory response. In short, that this calorie restriction seems to broadly modulate immune responses, at least in primates. So there's potential benefit, but most of the studies are still preclinicals. If you're a researcher and listening to Saliva class, maybe a nice field to explore even more clinically. And are there benefits in fasting saliva? And this is what I want to bring to you. And yes, and it's fascinating. This is one study that showed this, but it's so exciting that I already want to bring to you because I told you, right? I practice intermittent fasting. So fasting saliva may contain higher levels of nitrate. I've talked about nitrate here, okay? A precursors of nitric oxide, NO, a molecule with vasodilatory, antimicrobial, and microbiota modulating properties. So in 1991, Rahim and Jacob showed that fasting saliva in humans, okay, contained 50% more nitrate, had nearly half the salivary flow rate, we'll talk about that in a bit, and maintained stable calcium and phosphate levels. These findings suggest that fasting saliva may have a protective effect on teeth and gums. And what would be its effect in the oral microbiota? Well, very few studies have examined this relationship. One study showed that 12 hours overnight fasting did not significantly alter salivary microbiota, and studies during Ramadan fasting found changes in the gut microbiota with increased butyrate producing bacteria that could improve immunity and metabolism. We do not know yet how fasting affects oral microbiota, but it's also a promising research path. So, how about saliva diagnostics during fasting? Fasting saliva has been used to measure nitrate, urate, alkaline phosphatase, inflammatory enzymes, secretory IgA, and other immune markers. These markers help us understand how fasting affects inflammation, oxidative stress, and immune function, both orally and systemically. Therefore, it is a potential field as well in saliva diagnostics. Okay, amazing, Deborah. I always love when you bring science to Saliva Cast, but I'm a dentist, and so am I, and I'm here in my clinic, and so am I. If you can see the screen, I am right now in my dental practice. I'm recording you from the practice. So, what is the dentist's role in prevention and how to act even better in prevention for patients that practice intermittent fasting? Look, it is our responsibility as dentists to guide our patients who practice fasting. That's why I created the Oral Health Prevention Guide for intermittent fasting patients. And I want to bring it to you. Why can fasting affect oral health? Because when saliva production decreases during fasting, the mouth becomes drier, more prone to bad breath, and even a more acidic environment, increasing the risk of caries and tooth sensitivity. So, tune up the volume. I will give you right now my 4 essential tips, and you want to take note of this to take better care and act in even higher level in prevention for patients that practice intermittent fasting. Here we go. Number 1, stay hydrated. This is mandatory. Drink water regularly to keep saliva flowing. Number 2, you want to reinforce oral hygiene. Brush your teeth and tongue after the last meal, before fasting, and right after breaking the fast. And very important, it is use a fluoride toothpaste without sodium lauryl sulfate. Okay, without SLS. It's written in the toothpaste. Number 3, avoid alcohol-based mouthwashes. Choose, if you have been prescribed oral mouthwash, choose alcohol-free options or those with moisturizing agents. And number 4, and you saw it coming, get a salivary evaluation. Ask your dentist for Saliva Pro validated tests. Saliva tests can identify changes in pH, flow, and microbiome before symptoms appear. And when to see a dentist? Well, you tell your patient that when they experience frequent dry mouth, persistent bad breath, and tooth sensitivity or pain while fasting, it's time to investigate. I encourage you, my colleague, to share this guide, share these tips with your patients. They will thank you and their mouths will too. And since I mentioned stay hydrated, I also want to mention a new technology that help you check hydration levels. So today we have portable devices like the MX3 Lab. This has been developed in Australia, is available all over the globe. It uses a test strips and an app to deliver real-time salivary hydration data. So this way, the patients can test their saliva multiple times a day and monitor hydration levels. It is a very interesting tool, for instance, during extended fasting periods, and for us dentists, it is an excellent preventive strategy for our practices. Very good. Intermittent fasting, the topic of today's Saliva Cast. What's the role of saliva in clinical practice? Intermittent fasting, as we spoke today, is becoming more and more popular. Although its systemic effects are well studied, not so much the oral implications. Still, oral implications are still emerging. We do know that saliva plays a central role. It protects, signals early changes, and may serve as a diagnostic tool. That's why we need to stay informed and really guide our patients and guide them to act in an even better way on prevention. And this is very important. Remember the 4 tips I brought to you today. Tip number 1, stay hydrated. Number 2, reinforce oral hygiene. Use toothpaste without sodium lauryl sulfate. Avoid alcohol-based mouthwashes. And of course, get salivary evaluation. And for you, dentist, my colleague, you want to learn the Saliva Pro method and take even better care of your patients who do practice intermittent fasting. Well, if you enjoyed this Saliva Cast episode, make sure to share it. Share it with your colleagues. Follow us on social media. I have an Instagram profile, a Dentista Cientista, and also an All English Instagram profile, which I'm actually broadcasting live right now, which is Dr. Deborah Heller on Instagram. I'm also present on LinkedIn, Deborah Heller on LinkedIn. You can check my website, salivapro.com, and you can find me on TikTok, Dr. Deborah Heller on TikTok. And you can also email me, Deborah at salivapro.com. You can always count on me to bring the newest developments on saliva diagnostics and to bring your dental practice to even higher level and to become an even more high level dentist and take even better care of your patients. As always, it's such an honor to connect with each one of you. Until next time, and take good care of your patients' saliva. Thanks so much.